Tonight on a story we told you about last week, a public health emergency started in Las Vegas caused by unsafe practices at a clinic. Now there are concerns about how widespread this is, how widespread it could really be. The story from our chief medical editor, Dr. Nancy Snyderman.
A patient's worst nightmare, a medical procedure, and then a letter stating you may be infected with a potentially deadly disease. That nightmare began with at least 6 patients of this medical clinic in Las Vegas. 6 cases of hepatitis C, authorities say, are linked to the facility. Michael Washington is one of those patients.
My life is on line with this problem, and it kind of scares me a little bit. It's frightening to be walking around really not knowing what's going to take place with you.
How could this happen? The state medical authorities say the clinic was reusing syringes and vials to administer anesthesia for 3 years. In addition to the 6 patients who are infected, another 40,000 clinic patients have also been sent letters warning that they too may have been infected with hepatitis and even HIV. Dr. Julie Gerberding is the director of the Centers for Disease Control. She worries this may not be an isolated situation.
The fact that these cases were detected does raise the concern that this could be the tip of the iceberg.
Now a total of 4 clinics have been closed. The head of one of those clinics ran an open letter in a Las Vegas newspaper this weekend stating, "We have carefully reviewed our procedures and implemented the changes they recommended. We are also working with third-party payers to be sure all of our patients who need to be tested are. I think it's important for the public to know that the chances of contracting an infection at our center from 2004 through June 2007 were extremely low." This is the largest public health notification in the history of the United States. And it's important because anyone who has received medication from a previously used needle or syringe is at risk for infection. And because these infections can be transmitted sexually, there's a ripple effect beyond the immediate 40,000 people, Brian.
So what can we do? How can we know about
Well,
this?
this puts a little bit of the burden on the patient. You have the right to say, is this a clean needle? Is it a clean syringe? Make sure it's opened in front of you. But to every physician out there who I know feels economically squeezed, you have to go back to that Hippocratic oath. First, do no harm. There is no excuse for this.
Yeah, this one is one area where they can't afford to say.
Right.
Nancy, thank you.
You bet,
as
Brian.
always.